Allen College provides students with many learning opportunities. Let's explore one of them, the fun and exciting educational modality, simulation. As adult learning theory professes, learning is a process, and we all have similarities and differences that help us to put the information we learn into action and apply it correctly. Simulation education allows the student to take information from the classroom and the laboratory setting and practice it in a hands-on manner in a safe environment that allows feedback and discussion. Simulation has been used in many industries to assist learning and skill development. Just as pilots use a simulator to learn how to adjust to critical situations in the cockpit, nurses and healthcare professionals use a simulator to obtain the knowledge, skills, and attitudes necessary to provide safe and effective care. Simulation provides valuable practice that can benefit your clinical competency and skills. The end goal being a nursing student who functions with increased confidence level and increase in practical knowledge and experience, which will provide a foundation as he or she enters the healthcare profession. The benefits of simulation have been researched and are founded in evidence and learning theory. Using simulation in nursing education allows the educator to break down the silos previously defined by each health profession and allows a new structure which encourages teamwork and interprofessional communication. In the simulation lab, the student is encouraged to identify and respond to abnormal assessment findings, which takes information gathering and interpretation skills, as well as critical thinking and problem-solving skills. It also provides a student with an opportunity to apply the knowledge that they have learned in the classroom setting in order to provide appropriate patient care through treatments, medication administration, patient teaching, and effective communication techniques. In some cases, it allows the student to practice skills that are high risk and difficult to practice on a patient in the clinical setting, and perhaps not seen very often on the nursing floor, such as CPR or intubation. Other times, it's the everyday tasks that are practiced, such as having a conversation with a patient, obtaining a set of vitals, or providing a comfort in some way. In any situation, the simulation environment allows the student to practice in a safe, non-threatening setting.
I think it helps us learn because it provides us an opportunity to practice skills that we're going to be using every day, as well as just see and correct mistakes that we make before we actually get to the clinical situation.
Simulation sessions are facilitated by nursing professors, which allows students a 2-to-1 ratio. Constructive feedback is provided in a structured, judgment-free debriefing session after the simulation scenario is completed. One focus that's carried through each level of simulation is effective communication. Students learn and are provided real-time feedback related to how they interact on a team with their patient and with practitioners in the debrief after the scenario is completed.
I would say simulation helps us learn essential skills in a non-threatening environment. Certain skills you would definitely want to practice before just going and working on a real patient, and so simulation provides that opportunity to practice those skills.
The simulation session is structured to allow for pre-scenario briefing and collaboration time with their partners. Prior to the start of the scenario, students receive report, a handoff communication, which provides them with the essential information they will need to complete the simulation. While working in pairs, 2 participants complete the scenario and 2 peers observe the scenario. After completion of the scenario, which takes approximately 20 minutes, the whole group participates in a guided reflection or debrief of what just took place. Students share self-reflection and are provided feedback from their student peers as well as the professors facilitating the scenario. The mannequin is then reset, and the process is repeated with the students observing, changing places with the students who just completed the scenario to complete their own different scenario. Studies indicate that the observer learns just as much in the simulation setting as the person who is actively participating in the scenario.
I would recommend students to do their homework first, come in with an open mind and have fun with it. It may be a little nerve-wracking at first, but once you get into it, it ends up being really fun.
For future students, if you come to Allen, I think this is a huge benefit for you guys because a lot of other schools don't have this opportunity to do simulation. So it just provides you guys with more experience, more real-life skills to learn and have fun with it.